As National Hispanic Heritage Month continues, we want to highlight and discuss some of the most common health issues impacting this community. Dr. Guadalupe Pete Zamora is a family physician who's held several leadership roles with the Texas Medical Association. He also has a clinic in East Austin. Good morning, and thank you so much for joining us, Dr. Zamora. All right, so some of the common health problems affecting this population include obesity, diabetes, kidney disease, cancer, and Alzheimer's. So, Dr. Zamora, why is that? And what are the factors playing into this?
Well, certainly the most common factor is the social determinants of health. They're food deserts, they're medical deserts, they're pharmacy deserts in those areas of poverty. Certainly people being poor and maybe having less education attributes to all those conditions you just talked about.
Right, and access to care.
And access to care.
All those are contributing factors. So what needs to happen to change that?
Well, certainly the Central Health, our hospital district here, has now opened up, or is going to open up soon, 2 clinics in East Austin, at Hornsby Bend and in Del Valley. That's going to give people more access to care. You know, I've heard that one of the major grocery stores will be opening up a grocery store soon in that southeast area, which also will give people access to food, good food.
Right, fresh food.
Fresh food.
And not just processed food, right?
Correct.
That plays a role in all our health. So all the diseases that we just mentioned, can you kind of talk about a couple of them, the symptoms and what people can do?
Sure. Well, the most common is diabetes, because diabetes really affects our whole body. And it's 1 in 10 Americans are affected by diabetes. In the Latino population, it's much higher than that. You know, because our way of eating affects what our blood sugars do. You know, that plus hypertension then leads to chronic kidney disease and chronic heart disease. Dementia, another one that you mentioned, is very common. In the Hispanic population, it's about 7% of the population. But down in the valley, it's up to about 15%. And maybe even larger, because many of our valley patients go down to Mexico to get treated. They don't actually get treated here. We don't get documentation. So the dementia, the Alzheimer's may be higher in the valley.
You know, the Hispanic population is the largest group, right? Not the largest minority group, the largest group in Texas, beating out white residents. So what can community members do to help?
Well, certainly getting them good access to care. That's the most important thing. What we need to do is make sure that people are being treated with preventive care. Going to see your doctor, getting your lab work done, having long talks with your doctor about what should I be eating instead of processed foods. Which veggies should I be eating? Which vegetables should I be eating? Which fruit should I be eating?
Sure, and that's one simple change. Are there some other simple lifestyle changes? Because we're throwing a lot of information at people.
Sure. The American Academy of Family Practice mentions that we should be all exercising about 3 hours a week. So about 30 minutes, 6 times a week. And if we could do more, that's great. But at least 3 hours of exercise, walking, is the easiest one to do. Just take a walk. Take your children out for a walk.
Yeah, you don't have to go for an intense run, right?
Right. No, just walk.
Walk around your neighborhood. Dr. Guadalupe Zamora, thank you so much for joining us this morning.
A pleasure. I'm always available if you need me.
Well, I'm going to keep him on speed dial, right?